Okay,
So
perfect.
thank you everyone who was able to sign on. I know I haven't talked directly with all of you. I've talked with a few of you. Mostly we've received your names through your manager director as somebody who would like to participate in the Allied Health Week, which is the virtual speaker series. So you're going to speak on your career to high school students. And so Deneen thought it would be a great idea to have a meeting today to talk a little bit more about that, help you with planning for your presentation for the students. And Deneen, I think where this really is kind of the first conversation for some of the people on the call, even if you were able to share a little bit of information about what the Allied Health Week is, in the Center of Excellence, how it all kind of goes together, and how we are partners in that with Horizon and the Center of Excellence, and how it's going to be a great initiative.
Awesome. Thank you so much for the introduction. And I am going to say really quickly, I have a couple of my team members here and I'll introduce them as well. But certainly right out of the gate, I know how busy everybody is. So thank you so much for taking the time. I'm hoping this is going to help alleviate any of the questions and stress, and like Morgan said, regarding the presentation, because we want this to be as easy as possible for you folks, because we know how busy you are. And we want really to showcase the experts that we have in our province here working at Horizon. So we're so excited that you've thought about it, and hopefully will sign up for Allied Health Week. And I'm just going to give a little introduction to a couple of folks that are around the table. I have my intern V. V, do you want to put on your camera and just wave for a minute?
Yep. Hi.
Oh, her camera might not be working. V is the intern for the Center of Excellence for Health, and she is going to be actually creating the schedule. So she's been doing a lot of the behind the work scene and putting a lot of time into it as well. Chinello is here as well. Chinello, do you want to introduce yourself and explain who you are and what you do?
All right, hi everyone. I am Chinello, Strategic Partnership Coordinator on the team. So I kind of work functionally across all our centers of excellence, energy, digital innovation, and entrepreneurship. And I'm all about operational efficiency, stakeholder management, and just getting all those great things happening within the team working.
So she basically keeps me on task. Isn't it great to have somebody like that? So I am going to start right away, and I think it's really important for you to understand what the Center of Excellence is and what the model looks like. So I'm just going to share my screen, and we're going to very quickly go through just a PowerPoint that I can get this to work. It's a very general PowerPoint. I'm not going to spend too much time on it, but I did want you to know that we are partners with many different health and social care partners in the province. So it's Shanix, New Brunswick Community College, Department of Health, Department of Social Development, MB Parks is not on there, but Department of Tourism, UNB, Horizon, New Brunswick Association for Nursing Home, Opportunities New Brunswick. Also, we are collaborators with the New Brunswick Health Research Foundation and Dalhousie Medicine. So a lot of the important experts and stakeholders in the province are coming together to look at this model. So really easily, I guess, explained is premise number one: if it was easier to connect with experts and bring real world context into the classroom, then teachers and students would have a more authentic and engaging learning experiences. So when you look at the top of the PowerPoint or of the slide, the teacher, as we know, is very busy. And in order for her to, or him, or they to plan an activity or opportunity, they have many different steps that they have to take. So they have to reach out to the experts, they have to coordinate it with their schedules, different things like that. So there's many different steps. With the Center of Excellence model, the teacher now knows that they can reach out to myself, who is kind of the pivotal point for the experts and for the teachers. And I can reach out to the experts and help bring the experts to the schools. And I'll give you some specific examples of that as we go. So premise number two: if we could better connect students to the multiple career options available in New Brunswick, then they would better understand the opportunities to build a life and career in the province. So really one of the biggest mandates for myself is to get students excited about what's happening in the province within health and social care, and get them to hopefully stay in the province and work. And as we know, with the labor market and recruiting right now, it's really important for us to showcase all the wonderful things that are happening here in our province. So again, this is the model. So we have our health and social care partners on the left-hand side, and then the K-12 schools, teachers and students on the right-hand side. And we have a beautiful website that I'll show you in a minute. I'm the lead, and then we have many supports, which includes Janello here on our team at EECD. And everything we do is for K-12, looking at how to connect the curriculum outcomes, because without connecting the curriculum outcomes, teachers have a hard time kind of grasping how this is going to help them. So, and it's not just a high school. A lot of people think that we're just speaking about career pathways for high school, but what we're trying to do is engage the students at a younger age so that they can start looking at pathways and what they look like, and really try and engage our students at a younger level. So this is just a picture of our launch. So we didn't launch until March of last year. We have a center for energy, a center for entrepreneurship, center for health, obviously, and a center for digital innovation that was just added last month. I know I'm going through this really quickly. Please stop me if you have any questions, but I just wanted to let you know that we have two priorities, and these priorities are set by the schools, not by us here at EECD. We want to know what the school's needs are, and focus on those needs, because it's well and dandy for us to, I guess, decide what we think is important, but really we want the schools to tell us what's important. So the two priorities are mental health and career pathways in health and social care. And just for 9 months, this is just our data from November to June, we had 579 teacher interactions, 4,437 student interactions, 58 professional learning sessions, 71 events and learning opportunities, and 35 website learning activities created. So what's next? Allied Health Week. So I am going to stop sharing. And I know that was a lot of information. I get really passionate and excited when I'm talking about the model, because I've been in the school system for the last 18 years. I was a health and phys ed teacher for 12 of those years, and then I jumped into administration, and I was the vice principal at Fredericton High School, which is one of the biggest high schools in the country. So it was definitely a roller coaster of a ride for me, but it really made me realize that we need to provide supports for our teachers to help them with their everyday curriculum delivery, but also we also need to help engage our students in a different way. What I would see in my office would be a lot of students that were struggling with what they were going to do and where they were going to go, and what could they do if they just got high school, and what could they do if they went and did their post-secondary. And so just trying to really engage our students and have that conversation prior to that pivotal moment in grade 12 when they're walking across the stage and everyone's saying, what are you doing? What are you doing? So really trying, and I use all kinds of different examples. One of the great examples from kindergarten, if you can wrap your head around it, is in kindergarten, one of our outcomes is washing your hands. Well, obviously everyone knows now how important it is to wash our hands, but it's been in our curriculum for years, and it's under hygiene. So wouldn't it be fabulous, and this is the way that you can take the model and put it to work, is wouldn't it be fabulous, instead of a teacher saying, this is why we wash our hands and let's practice washing our hands, maybe we can ask the question of, well, who told us to wash our hands? Oh, well, it's a health researcher. Oh, well, what do they look like? Oh, well, maybe we can take a look at a lab and go see where those health research do the research, and really try and engage the students at a younger level, to get them excited about being in a lab coat and what that looks like. And it's proven in research that young folks, if we can really trigger them at a young age, and you folks can probably remember maybe a lesson or something that happened in school that really did get you excited about your career, or what you're excited about. And it helps to kind of, I guess, bring the real world problem solutions, opportunities to the students, and not just be in the classroom. So that's really what the model's about. We're doing everything from giving free cognitive behavior therapy insomnia for teachers and for educators. It's a free resource for teachers. It's with a specialist in Nova Scotia. So really trying to promote and support our teachers' health as well. This week we're starting Wildlife Wednesdays. And with that, I'm just going to share my screen again and show you. Think it would be. Now, does anybody have any questions? Because I know I'm going a mile a minute. Okay, so here's the website. And we're really excited about the website because, do you see the website there?
Yep.
Okay. Oh. Because we love the way it looks, one, but two, it's a very easy, accessible, equitable way to provide opportunities for students across the province. And what we have found is that there's very different education systems that are happening across the province, even though our curriculums are identical. So if we take a look at learning activities, this is where different activities are posted, and they're for everything from envisioning a future in health with Horizon Health, and that's just an activity for high school students that Morgan and Lisa and Jillian helped me create. So very easily you just click in, and it gives you an overview, what you'll need, instructions, very, very basic. We want it to be very easy and quick. Always connecting to the New Brunswick curriculum outcomes and the global competencies. And what we also love is that up on the side, if you have your downloads, it's very easy for teachers just to click in there and get there. Under activities, I'm not going to go too far into it, but we've had everyone from the UMB nursing students actually create some of these activities. We had a dietitian intern create the Canada's Food Guide toolkit. So really working with all different types of students to create content for the teachers to be exposed to. So experiential learning is more the hands-on and time-sensitive activities. So right now, tomorrow, like I said, we're having Wildlife Wednesdays. So the Wildlife Wednesdays is actually a partnership with the Department of Tourism, Department of Natural Resources, and it's called Wildlife Wednesday. And every one Wednesday a month, we're doing an actual live session with one of the experts. And this is a great example of how we're going to showcase Allied Health Week. So Allied Health Week is going to be listed under the experiential learning tab, just like this. And we'll be able to click in and go to the Allied Health schedule. After your presentations are done, we're also going to be able to post your presentations, as long as you're okay with recording them, on our speaking series. So last year during Mental Health Month, we had over 700 students attend these sessions, and I was able to post the sessions afterwards for teachers to take advantage of. And with our data, we can see that teachers are clicking into many of the recorded sessions. And I do want to just take note of this beautiful picture here of Sophia Kirsten Abbas. She is a 15-year-old student from Nova Scotia, and her aunt was killed in the massacre, and also spoke about being a teenager during COVID and what that looks like. So I know that's a lot of information. You're probably thinking, why is she sharing so much of this information with us? But I did want you to understand what the model was, why we're doing what we're doing, and why we're so excited about Allied Health Week, because a lot of our actually, a lot of our teachers and a lot of our students think, when you think health, they think nurses and doctors. And nurses and doctors are so extremely important for our health system, but there's so many other beautiful professions that we're not talking about as much probably in the school system that we should be. So that's why we're here. So I'm going to stop for a minute. I know that was a lot. Does anybody have any questions, concerns, thoughts?
Hi, Janine.
Yeah.
It's Margot Cartwright. I do have a question for you. So I'm I'm going to talk about speech pathology, I believe, for Allied Health Week. And I guess my question is, because there's also speech pathologists within the education system, are they also being approached? Will they also be presenting? Or that was kind of my one, because it is a piece of kind of that education, right? It's kind of like you think of healthcare, you think of doctors and nurses, you think of education, you think of teachers. So I just was wondering if kind of in that piece of the puzzle, I should also cover the education part.
Well, we had such a beautiful response from the folks in Horizon that this is basically going to be Horizon Allied Health Week. And we are also going to be invited MBCC to do a tour. But Margot, the presentation, what you hit on is absolutely up to you. So I would not say you have to go into what they do for the education system at all. I think you just need to speak to what you do and what you offer, what your services offer, and just tell a little bit about that.
Okay, perfect. Thanks for clarifying.
Okay. So again, I'm probably overwhelming you, but I hope that my next PowerPoint is going to help kind of, oh, Danica?
I just had a question. I'm Danica Walls from the physiotherapy group. We also have physiotherapy assistants and OT assistants that are part of our teams. But I'm not sure that those would fit within our presentations.
If you want to have more than just you during the presentation, that's great. We had a panel of Dalhousie's students do a session last year, and it was fabulous. And everybody took 5 or 10 minutes. So if there's people on your team that you want to invite and have part of your presentation, absolutely.
Yeah. And is there someone here from OT? I know most of our we have assistants.
I'm here.
Hi. Because most of our assistants are OT-PT trained, which is a program within the province. So it may be another option for high school, because I find high school kids really don't know a lot about our professions. I've been doing school presentations for a long time.
Oh, good. So you're our expert.
No, definitely not an expert. I muddle through every time, but it is something that, guidance counselors don't know really a lot about the professions and what you need to get to where you want to be, or what they offer. So I'm excited for this.
Oh, thank you. That's so exciting. So what I'm going to show you next is actually a PowerPoint that Chanello has created with myself. And it's going to kind of help frame your presentations. So I am going to just go here and I will share my screen. Chanello, did you want to go through this? Are you okay with me going through it, or what's your thought?
Definitely go through it. I'll be here to support you. I'm having some internet issues at the moment.
Okay, awesome. Okay, so can you see my screen?
Yes, we can.
Perfect. So this is just kind of, I guess, what we would foresee you putting into a presentation. But again, I love to give the presenters the autonomy and the strength to pull on whatever they think they are good at. And I would never want to say this is the template that you have to follow. I did have a beautiful MBCC instructor. She presented last year, and she presented from her lab, and she didn't use any PowerPoint. She was just in the lab, showing the kids the lab, showing them what she was doing in the lab, and it was fabulous. So please don't feel like you have to do a PowerPoint. That's not the purpose of this template, but it's just going to help. We will send this out after. I'm not sure if I sent it already, but we'll send it out after, so you at least have the information. So the objective is to find out what a typical day looks like in the life of an expert career in New Brunswick. So this is just what we're going to talk about here in the PowerPoint. So the first kind of introduction would be just about you. So, and again, these are just questions that you can think about. Does not have to be included in all of your presentations, but we just, when people start thinking about what they're going to present on, it's nice to kind of have I guess a goal or maybe a roadmap to follow. So that's why we did this up. So just different questions there. I'm not going to go through them all, but you could have a picture of yourself if you're doing a PowerPoint, or you can just be on the screen telling the folks who you are and what you do. So personal skills. So what do you do in your spare time? So it's nice to bring a personal kind of I guess, lens to the presentation, because some of our students, and this will be for middle and high school students, so it's kids from 10, 11, 12 to all the way up to 18. So certainly giving them a little bit of a personal interest at the beginning sometimes helps engage students as well. So did these hobbies play a factor in your career? What do you consider your greatest achievements? What is your most marked characteristic, and what is your motto? I'm a big person with mottos, and I do a lot of work with mindfulness with the students, and my motto is, my breath is my anchor is my breath. And for some reason that always seems to calm the kids down, and they love that as well. So again, just a suggestion. So your career profile. So again, looking at how long you've been working in the field, what made you decide to pursue the career, maybe talking about some of the positive and negatives of your career, looking at your skills, relationships, looking back. I always like that question. What do you wish you would have known about your job before starting? What could have helped with the experience and your career path? So was it a very straight career path? Were you moving from different career to different career, and that type of thing? So your education and your training, what kind of education and training did you require? And how did you get into your current job role? And do you stay current with certifications, that type of thing? Again, just a suggestion to include. So your work experience. So this is where the meat is of the presentation, which is the exciting part. So looking at what it is that you do in your typical day. And when people look at me when I say typical day, I'm like, I know there's no typical day probably anywhere right now. We're getting back to a little bit more typical. I wouldn't say normal, but certainly as a teacher, if someone asks me about my typical day, I say, well, there is none. So I'm sure that you probably are the same way. But looking at the students, there's kind of these little 2 or 3 minute videos that they're having a lot of success with on the internet. And it's a typical day as a marine biologist, or a typical day as a teacher. And the students just want a quick glimpses what it is that you're doing every day, all day. And then lastly, your career advice. So if you could give students one piece of career advice, what would it be? What advice would you give others that are looking to move into this field? Is there anything else you would like to add? And then follow up is really important for these presentations as well. Like I said earlier, if you're okay with us recording it, I will be posting it. But it'd be great for you to offer a follow-up with either your email, or they can contact me, or maybe even a link if they want to find out more information about your career, if you're a part of an association or maybe an information packet. That would be fabulous. And then just interview tips. The video should be 15 to 20 minutes in length. So for Allied Health Week, we're saying around 30 minutes is a maximum, and we'll have 15 minutes for questions. Or sometimes, I know for me, when I present, I definitely go over every single time. Connect. It is vital to make a personal connection with the audience. Your ability to establish this connection and help engage the student and teacher is the key to a great presentation. And then practice. Obviously, you can practice on your own, but certainly if you wanted to reach out to me and you wanted to practice with myself, or if you had questions, I can help facilitate that as well. And for the presentations during Allied Health Week, what I typically do, we have a schedule right now of 10:30 or 1:30. I'm not sure if Morgan or Jillian have offered up that information yet, but I will typically sign on 15 to 20 minutes early and make sure that everything's okay technology wise. We usually have a backup if you can send me your PowerPoint or that type of thing. But again, not a have to. I have some presenters that they're like, you know what, I'll sign on 5 minutes before. I do much better on the fly, and they nail it. So it is whatever you're comfortable with. I'm not a PowerPoint person. I can say that right now. And the fact that I just did 2 in a row is like driving me crazy. I like to speak to my audience and make eye contact and really try and engage the folks that are behind the camera. So certainly this is just, an example, but kind of gives you an idea of what we're looking for a presentation. So that is really all I have to share. but I'm sure you have questions, concerns. I do have one other thing that I can share, but I'll wait for questions first.
If I could just add to Deneen, well, that was a wonderful presentation and I think really, really informative for everyone. But I would just add to everybody from Horizon on the call that for the follow-up portion, if you don't want to put your actual email or contact information, we would always want to promote that students can request job shadows through Horizon through our education placement portal. So you are always welcome to put that on there, and the students
Perfect.
go in, they request their own job shadows, and then it comes to the education placement team to facilitate. So that's always an option for you to include in your presentation. And I see Dr. Savoy has her hand up.
Yeah, I unfortunately have to leave. I have a conflict in my schedule. So will the specific times for each of us be forwarded soon? I'm
Yeah.
I'm starting to book in those times. So
And some people have heard from us already, and while we just try to coordinate the schedule, but it is today and tomorrow. You'll be getting an email from
Okay.
us, Joanne. Yeah.
Perfect. The other
Thank you for
question that I have.
attending.
Oh, I have another quick question. So will the recording happen when I do my presentation, or do you want that done ahead of time or separately?
It typically we would love to have it live, and then we would
Okay.
record it so that we have it, and we can post it usually within 24 hours.
Okay. All right, that
Yeah.
sounds
We don't want to make any extra work for you.
okay. Well, I've had it before where I've had to record it ahead of time and then, so I can
Yeah.
do either one, but yeah, I guess that would be a time saver if I just have to do it the one time.
Thank you so much.
Okay, so so I have up to 30 minutes, or does that include questions?
No, 30 minutes and then questions.
And then questions. Okay.
Yeah.
Sounds good. I can fill that up. No problem. Got lots
I
to
know.
say.
I love that.
Okay. Well, thank you very much.
So much. Any other questions?
Deneen, I've got a question. It's Brittany from
Sure.
OT. So I guess I more just wanted to clarify that I wrote down the Coles notes correctly. So the target audience that we'll be speaking to are middle school and high school, not university aged.
Right.
And that we can take your template and adjust or do our own format as well, correct?
Yes, and actually,
Okay.
there was one other thing that I wanted to share because we actually created a template for the Wildlife Wednesdays, and Chanello and I can work on doing an actual allied health template, but I wanted to know if that would be useful.
Yeah. Yeah.
See lots
Okay.
of nodding heads.
Yeah, we October is OT month, and so we have been trying over the past number of years to do more so kind of your grade 11, 12, and then university student what is OT, because nobody knows what we are. Anyway, and I'm glad to see this approach. It's been really well received, but we've had a hard time connecting, like reaching all of the guidance counselors because staffing changed. And so, we didn't have that one point of access. So it's really helpful when this came across my email. I was like, yes, please.
Yes, exactly. And anytime, everybody on the call, anytime you have something going on that you want to really focus those high school students around, certain, because I'm sure there's lots going on in Horizon that a lot of people don't know about. If you want to forward anything to me, and if I can put it on the website or really help promote it, that's my job. So I absolutely would love to be that person for you to kind of help expose the students to what you folks are doing. And I'm going to really quickly, I have one screen that's black now. What's going on here? End show, here we go. I just wanted to show you the template for the Wildlife Wednesdays because I thought it might give you an idea of what we can do for Horizon. Obviously, it's not going to look like this, and I'm thinking we'll do yellow. Chanello is amazing at, Sherelle's on our team, but she is amazing at putting these together. And so this is what we did for the Wildlife Wednesdays. And I'm not going to go through it all, but it just, it gave you, everybody had like the same type of front page. And then you can cut and paste whatever you want, whatever pictures you want in there. There's different headers, but again, we want to make your life as easy as possible, and just provide some type of template if that's where you want to start. So if I did see a lot of nods, if that's going to be helpful, then we'll start working on that and hopefully get that sent out, maybe by next week or by the end of the week. That would be great.
Perfect.
Any other questions, concerns? You guys are a great audience. Wow. When I did Wildlife Wednesdays, they had a million questions, but go for it.
I have one last question, just to clarify the time, based on what the lady just said. So it's 30 minutes plus 15 minutes of questions, so it's 45 minutes total?
Right. And you know what? If there's no questions, I'm actually really good at filling that space, and I would probably ask my own questions for 15 minutes. So don't feel like it's a timed event and you have to be done at 30 minutes and we have to be done at 45. Basically what I do with the teachers, because teachers are on a bell schedule, and the 2 times that we chose a day, that's strategic because we looked at all the bell schedules for the province and where it would be best to fit those sessions in. It's not going to work for everybody because everybody has a different spell schedule, but teachers will stay or leave as they can. Some teachers, they let the next class teacher know that we're doing a presentation today. We really want the students to stay. Is it okay? That type of thing. So don't feel like there is a strict timeline at all. And some people go for 20 minutes and it's fabulous. The young girl that I spoke about earlier, Sophia, she spoke for 25 minutes and it was probably the most engaging conversation that we had for the session. So.
And I think that clarification is good, Deneen, because I believe the original document about the virtual speaker series that went out identified that the presentation should be between 15 and 20 minutes.
Right.
So yeah, I think if we have it, especially on this recording and on this meeting, just to clarify that it can be 30 minutes plus question.
And this is just because it's Allied Health Week. So typically a speaking series would be just 15, 20, but because it's Allied Health Week, we really want to give you guys that time. So yeah. But again, timing to me is usually we have more to say than not. So Pam.
So someone said it was middle school and high school. So what would be the average age? Like what's our sort of target age that we're aiming for?
I would say 14, 15.
Okay.
But again, that's my target. But I know that a lot of students that sign in are in grade 11 and 12 because they want to hear from you folks. So it's a little, it's difficult because it's very different age development wise of where they are with their careers and also with their brains. So I know that's difficult, but usually I will say that you're probably going to be more high school students that sign on. But we're trying to get the middle schools kind of on board. I would assume that I would say it would be 75% high school students.
But it sounded like you're sort of aiming for not the grade 12 high school students, a little younger than grade 12 on average.
We're trying. Yep.
Okay.
Any other questions at all? Tracy.
Hi, just to clarify, I was reading through the virtual speaker series document that was sent along at some point, and just clarifying that it's a live interaction on that date and time, and you guys record it and then post it to the website. Okay, so I was just reading through, it said videos should be 15 to 20 minutes, but you mean the presentation should be, but you're saying 30 to and then 45 minutes with the question period. Okay, I'm just trying to envision if I get Sydney's younger, you know, new to the profession, very vibrant person. And then my role will be to talk about, because we have a radiography school that is Horizons, then I just want to add that piece on, and so you can actually study in the province and
Yes, that's a
and
fabulous piece.
in a school that also, leads to career possibilities. So I'm just trying to decide whether I come in and just talk about it, whether I have a video is that just of our classroom and our x-ray rooms and our students that are currently in the program. I was just trying to envision
awesome.
that. I'm not sure, I wouldn't call myself tech challenged as far as creating videos, but I'm sure my students would be all over some sort of TikTok type.
Love it.
Anyway.
Yes.
Okay.
Yes. And, like I said, the instructor at NBCC just sat right in her lab. So maybe in your area where, you can show the students some of what's happening around. I'm not tech savvy either, so I don't know how easy that would be. But certainly if you wanted to create a video of a virtual tour, that would be perfect.
That's what I was kind of thinking. This is what it looks like to study here type thing.
Yeah.
So our classroom is actually in the X-ray department at the Moncton Hospital, so it's
So
pretty
cool.
integrated.
Yeah, I'm glad that we clarified that, because the virtual speaking series document that was sent out to All Horizon, or to Jillian and Morgan, that's basically an ask or a bucket of what we're trying to do with all of our partners. And the Allied Health Week is actually very streamlined. So we're doing this on purpose, and it's just a little bit different than the speaking series, but same type of, I guess, request, just really trying to do a lot of them in 1 week to really help celebrate Allied Health. All right. Well, if there's no more questions, certainly if you want to stay on the call, I'll stay on for a few minutes if you want to just speak with me on your own. But I'm very excited to have you part of the week. We will be putting a little blurb into our newsletter. Jillian and Morgan were very kind to help us create kind of a little blurb about Allied Health and what that looks like. And we're going to be putting that into our newsletter for November, and I will send that newsletter off to Jillian and Morgan so that they can share it with you folks. And certainly in the newsletter will also be the link to all of the presentations that were reposted on the website. And I will say, just because I always take this opportunity to say, if you have anybody or any programming that you think would be useful to be posted on our website, that's what we do. We do not, excuse me. We do not support anything that costs money. Everything needs to be free, accessible, and equitable across the province. And just really trying to help expose our students to what's happening in the province in health and social care. And we're doing fabulous things. So I get to be I guess the person that gets to showcase these beautiful things. So it's a great job.
Well, thank you so much, Deneen. And so this session has been recorded. I think we're going to finish recording it here in a minute, so you can come back to it if you have any questions. And we will be sharing it with anybody who wasn't able to get on the call. And as I had mentioned before, if you haven't heard from Jillian and I yet about the tentative schedule dates and times, you will hear from us today or tomorrow. So we started reaching out last week to start coordinating that, and we'll be looking at finalizing that right away. Perfect.
Awesome. And anybody that's listening to the recording, if you want to reach out to me directly, certainly feel free. Yes, my email, I should put it in the chat real quick, and then I will stop the recording. And if anybody has additional questions that's on the call, you can certainly stay on as well. But thank you so much. And it's been lovely to meet you.
Thanks, Deneen. Thanks, everybody.
Thank you.
Thanks.
Bye.
Thank you.
Thank you. Bye-bye.
Okay. I think we're good. I'm going to stop recording, but Jillian and